Hi, my name is Molly, and I decided to do my professional practice model video report on Sentara Healthcare. Sentara Healthcare is a system consisting of 12 hospitals, multiple specialty facilities, and primary care providers across the state of Virginia and North Carolina. For their nurses, their professional practice model comes in the shape of a Parthenon, where it has two foundations supporting three pillars, all coming together to form the roof. The foundation of this professional practice starts with creating a culture of safety and accountability. This means the nurses need to promote safety and hold each other accountable to help promote the self-care for the patients, which comes to the second foundation, which is Dorothea Orum's theory of self-care. It is our goal as nurses for Sentara to promote self-care for the patients as much as physically possible. And on top of these foundations, we have three pillars. They all have different terms, but all work together. The first is the relationship pillar, in which the nurses and the doctors and the whole healthcare team are to form a caring relationship with the patient and their families that we are providing a service for. The second pillar stands for teamwork. The healthcare team works together to utilize evidence-based practice to promote the health and well-being for every patient and their families along the journey, which comes to the third column. The third column is labeled coordination, in which the healthcare team is coordinating with the patient and the families and encouraging decision-making as we promote a return to health and well-being. All of this comes together to form the roof of the Parthenon, in which we are creating an environment of health and well-being for the patient and families. So this PPM definitely promotes decision-making and changes involving the patient, family, and healthcare team through the coordination and the teamwork. And for that, I would also say it is giving a basis for holistic patient care, because we are promoting, getting the patient and the family involved. We are promoting their decision-making, safety, and we're not just throwing it all at them. For clearly providing a framework for nursing practice, well, it's giving us the basics. It's telling us that we need to be safe and hold everybody accountable, and that we need to work together. But it's not specific either. It's just telling you need to have a relationship with the patients and the families. You need to be safe and hold each other accountable. But it doesn't really serve to help you critically think. It's not telling you that, oh, well, his blood sugar is 90. Maybe I should ask if I could hold the Lantus. It's not doing that for you. It's just giving you a framework. And sometimes just the basic framework isn't always going to be enough. I know this, as I do work for Sentara, and this professional practice model they do emphasize, but it doesn't always answer all the questions you might have when it comes up. What if you have a patient who has no family, who's so demented they don't know who they are? It's going to be harder to create a relationship with that patient than it might be somebody who's walkie and talkie, for example. But you can still have that teamwork and the coordination part of the practice when it comes to trying to provide a safe, caring environment for this patient. I think that is all I have. Thank you.